The participants, please, can you mute your microphones, or the participants? Let me check for Professor Mbamba. I can see Professor Mbamba is also joining now. Good afternoon from East Africa. This is afternoon. We welcome you to this very important webinar, which has been organized in collaboration between the University of Dar es Salaam Business School and Empower School of Health. We are having a partnership now, and we have already signed an MOU. So we welcome all of you in this webinar, which is mainly focusing on career development in health supply chain, where we expect to see what is the current status, the gaps and the future prospects, which should help us or guide us whom we want to develop ourselves in the same field. But we also expect that this will be a very inspiring session, eye-opening session, so that those who who are still developing themselves, they can be able to develop themselves in this particular field. So we are expecting to have a webinar of 1.5 hours, where we have briefs about the two partners, that is the University of Dar es Salaam Business School, as well as Empower School of Health. And then we go straight into the matter. So I welcome all of you, and we hope to have fruitful discussions. And please make sure that you are using the chat room. If you have any questions, you can use the chat room. Use the chat room to bring up the questions as the presentations are going on. Yeah, even if you have any requests, you need clarification, you can use the chat room. But we also have a question and answer session at the end. So one of the very important issues also in this webinar is that we are going to have some scholarships announcements. Yeah, and for that case, make sure that you observe the processes and the procedures for the application for the scholarship. Yeah, so that you can be able to take advantage of this very important opportunity. So with this few remarks, I welcome all of you, and please get engaged. Next.
Yeah, so I'll now welcome Professor Paul for the welcoming remark and discussion about the partnership we have. Over to Professor Paul.
Good morning, good afternoon, everyone. Can you hear me okay?
Yes, Prof, we can hear you.
Yes, I can hear you.
Wonderful, wonderful. Thank you very much. So as we kick off this partnership, I'm honored to see an incredible panel of speakers, and of course, personally greet Dean Mbamba, along with Dr. Funda Funda, with whom I've been working for more than 10 to 15 years. And he finds himself as now the interim CEO of the Africa Resource Center, which is focused on supply chain. Great to have you with us. Prof. Andy, who's been my mentor and guide for more than 20 years. He's really an encyclopedia when it comes to global health and supply chain, and helped write the book on supply chain, what's called the Yellow Bible. And Mr. Adam, who I'll be meeting for the first time. Gladness, thank you for all the introductions, and I'm sure there's a more detailed introduction, but I wanted to make a personal introduction from my side as well. So first, a brief introduction about the Empower School of Health. So Empower is a Swiss-based public health institute, and we were founded by management professionals and scientists and medical doctors and pharmacists, all of whom had previously worked either for the United Nations, for international donors, and international NGOs. So we really bring a depth of experience. We work through partnerships, and UDBS, the University of Dar Business School, is one of our top-ranked partners, and an incredible. I just ask everyone to mute their mics, please. Could I ask the admin to automatically mute everyone's mic? Okay, thank you. Like I was saying, we work through partnerships, and the University of Dar Business School really is one of the top-ranked, top business schools across Africa, and we're honored to be one of their partners. Our mission specifically is to support professionals like yourselves who would like to launch their careers nationally and internationally and take yourselves to even greater heights. And you will see that many of our graduates and alumni are working for the United Nations. They're working for private sector, they're working for ministries of health and international NGOs. And the community of alumni work and support each other. And of course, the faculty members support in guiding you and giving you these opportunities, not only for a full-time career, but also supporting you in the interim, identifying opportunities or short consulting assignments, and even internships. So we really handhold and guide you along the process. So that's the Institute. And a little bit about myself, a personal story. So you could probably guess that I grew up in India, but you probably won't guess that I also grew up in Nigeria and the UK. And then I moved to the United States, where I did all my education, my graduate, postgraduate educations. I studied pharmacy and management, and we bring both public health and management from UDBS together in this partnership. And then I went on to work for the Global Fund, where I headed their Procurement and Supply Chain Division. I guided the Gates Foundation, Management Sciences for Health, and really worked across various countries, Geneva, Afghanistan, which right now is quite a disaster. Unfortunately, it's very sad. Worked in Ghana and 20 other countries. So when it comes to education and continuous learning, it has completely changed my life. And given the current environment, where knowledge and technologies are changing every day, we have to keep learning, or else we risk becoming irrelevant. When it comes to global health and supply chain, the landscape is changing even more rapidly, and the ongoing raging pandemic and even has completely changed the landscape. And as a result, the human intervention, both technological and financial, to help respond to the pandemic has been tremendous as well. Is it enough? Probably not. But we professionals in public health, in supply chain, are making a difference and can really make a difference. We are working right now with the World Health Organization across multiple countries to train, to capacitate, to inform, and to strengthen the capacity of ministries of health and global health supply chain to respond to the pandemic. We are working with UNDP, we are working with the Global Fund, USAID, GHSC, PSM, and various others in this fight against the pandemic and other public health problems. So UDBS and Empower, along with our global partners, will bring you various options for learning, on-the-job, technical, managerial, and leadership-focused support. So with that, I thank you again for being with us, and I give the floor back to the moderator. Thank you very much, Gladness. Back to you. Gladness, would you like the floor?
Yeah, thank you very much, Professor Andy. And Professor Paul, thank you very much for a nice introduction about this particular partnership. May I take this opportunity also to inform you about the housekeeping. Yeah, we would like to request all our dear participants that you mute your mic and turn off the video, except for the presenters. And I'd like to emphasize on the use of the chat box. And if you have anything, you can also raise your hand. Yeah, use the icon below. But also, we would like to request that you participate in a poll that will come out so that we can be able to understand well your interest. But note that this webinar is being recorded and will be available through our social medias and also through the Empower School of Health YouTube channels. We also have the social media platforms for the University of Dar es Salaam Business School. So we also post on the same, including the university website. The presentations will also be shared with all participants, and try your best to engage in these particular discussions. Next. We also would like you to observe the timing, particularly to our dear panelists, so that we can have enough time to get inputs from our participants. Next. Now we have the poll. Please try your best to answer these questions. We request all the participants to answer these questions so that we can understand better about your interest and who you are. Thank you. Please answer the questions through the poll. I can see no one has already.
Yeah, and you can scroll down as well.
Yeah,
there's
scroll down,
a total of 5 questions. Yeah.
Yes. We still have only 14%. Please try your best. 27%, 29, 31. Thank you, thank you. We are doing well. 45, 47, thank you. Wow, at least more than 50% now. %. Maybe we can stop there. Thank you very much. From the poll, it indicates that 62% participated, and out of all those who participated, 70% were male. And in terms of the age, majority, they're from 30 to 40 years, which is very interesting that we are having a young generation coming on board. And in terms of the geographical area, 83% they're actually Tanzanians. Yeah, that's also something good to note. And in terms of academic background, I can see majority, they have a pharmacy bachelor's degree, that is 27%. And in terms of work experience, I can see majority, they have less than 5 years. So there's this potential for professional development. So thank you very much for participating in this important tool. Yeah, it was quite informative. Thank you. Next. Professor Paul. Professor Paul.
I think I've already made my introductions. So
maybe you can.
Did you want me to quickly showcase a few of these slides? Would that be useful?
Yeah, Prophet,
yes.
Good if you can just give a brief about Empower, about working in Africa and all points.
Right. I think we've given, so just to mention then, to, I guess, a visual with my voice as well. You can see all the different partners and clients that we have worked for on the right-hand side. And we've reached over 200,000 people through our trainings and education and delivered more than 1 million hours of learning. Next slide, please. This gives you a really good sense, and this is just on the African continent when we work, how we work together. Of course, the latest and one of our more important partners, UDBS. We're working with universities, professional associations, academia, councils and societies. Let me just ask Gladness, in Tanzania, we've signed up partnerships with anybody else as well linked with this to support our Tanzanian brothers and sisters?
Yes, with the WOFA, and there are ongoing discussions with the Farmers Association and the Farmers Council. Yeah.
Okay, wonderful. So we really bring together the capability and expertise of the management experts who want to do health and the health professionals who want to get better at management and really bring the two together. And we've been working very closely with the Chartered Institute of Logistics and Transport, with the Ministry of Health, the Pharmacy Council of Tanzania, among others as well. Next. So the only person I will highlight here, not myself, is the person on the far right, is His Excellency, the former President of Ghana, President Kufuor, who is a mentor to our organization and especially to me, and is an incredible human being. He is about 82, 83 years old, but has a stronger memory and more knowledge than most of us and many of us combined probably. He still reads 3-4 hours every day. And when we do our leadership seminars, he's actually present and shares his guidance and experience. It's really wonderful. Next.
Thank you, Professor
Back to
Paul.
you.
So we welcome Professor Mbamba, who is the current Dean of the University of Dar es Salaam Business School. And he's the one that is actually an accounting officer as far as teaching, research, and consultants here at the University of Dar es Salaam Business School is concerned. So he has also been the managing director of the University of Dar es Salaam Computing Center, but he has also been engaged in the academic affairs of the university. And he was a former head of the Department of General Management, where all the logistics and supply chain subjects are being hosted. So in terms of the academic background, Professor Mbamba has a PhD in business administration, where he has researched extensively on information systems. Yeah, up to now, he has been doing a lot of research in the same areas, and he's a quantitative professional. So that is generally who is Professor Mbamba. Professor Mbamba?
Yes.
You are warmly welcome this afternoon to give a brief about the partnership and the University of Dar es Salaam Business School. Karibu sana.
Sante sana. Good afternoon. I hope it's all others. If it's good morning, good evening for everyone. As he introduced me, I will talk a bit about University of Dar es Salaam Business School. University of Dar es Salaam as a whole started sometimes 1961, but 1979, formally, the then Faculty of Commerce was introduced, and thereafter it was transformed to change into the University of Dar es Salaam Business School. Currently, the school offers 7 undergraduate programs and 9 postgraduate programs, and it's organized into 4 departments. Department of Accounting, which handles all issues related to normal accounting, including taxation. We have a second department, which is Finance, which handles all issues related to finance and financial services like banking, insurance, actuarial sciences, and others. We have a third department, that is a Department of Marketing, which is according to our structure, it handles all issues related to marketing, international trade, international business, tourism, entrepreneurship. And the last department in the school is the Department of General Management. In this department, all issues related to human resources management, strategic management, issues related to decision sciences, as well as logistics and international transport, where they are supposed to be. And hopefully this one, despite that, will be coordinated from, managed somewhat from my office, but still Department of General Management is expected to be thoroughly involved into a number of issues. University of Dar es Salaam Business School is engaged in quite a lot in international engagements. We have been partnering with several other institutions around the globe, whether with locally in Tanzania. We have been partnering with other countries, especially in the regions like Kenya, Uganda, through several several organizations like Operations Research Society of East Africa. Not only that, but also in Africa, but for example, Association of African Business School and others. In addition, we go even beyond the continent of Africa. We've been partnering Western Europe in several countries, in several universities in Sweden, Denmark, Norway, UK, as well as North America, Southeast Asia. And now, we are really eagerly waiting, to move further with our friends, Empower. Maybe this is, we are like any other university. I don't want to repeat. We're supposed to do teaching, researching, providing services. I just consider to be normal for a number of institutions. Because of time, let me end up here. In case something more is required, I can come in back. Thank you.
Thank you very much, Professor Mbamba, for a very good introduction about the university and the business school. So if you have any questions, you'd like to know more about Empower, you'd like to know more about the business school, please use the chat room. Yeah, you are warmly welcome to use the chat room. And let me now bring you forward to the main focus of this webinar, and this is on career development. We are all eager, we are all excited to hear where should we put our feet on. And I should let you know that this platform is also going to inform the future interventions that are going to be implemented by the Empower and the University of Dar es Salaam Business School. So feel free to recommend, use the chat room to recommend what you think you need to be, in terms of the skills development and maybe even the methods that you think is more appropriate. So use the chat room to give more and more of your ideas. So now, next, let us start the main discussion. And our first panelist, this is Dr. Boniface Fundafunda, who is now the CEO of the African Resource Center. And what I understand, ARC is also supporting a capacity development in health supply chain. And we are very grateful because at the business school, we are one of the beneficiaries from their research grant, which we conducted a research in the same area. So we welcome you, Dr. Boniface Fundafunda. And it's very important, it's very interesting to have him on board, as given his wide experience in the health sector. Yeah, he has been engaged in health policy, planning, strategy, operational systems, and business development. And in terms of years of experience, is quite a good, very, very wide experience on 25 years in the issue of access to medicines. And it means that he has been engaged with the health supply chain. And in terms of academic background, he's a pharmacist who has graduated from Robert Gordonson University at Aberdeen, Scotland, and also from Exeter University, where he got an MBA in international business. He's an author and a contributor to several books. So you can do your search to get more about him. And latest, he's on traditional medicine and knowledge in Zambia. Dr. Boni?
Thank you very much, Gladys.
Thank you very much.
Thank you. Colleagues, thank you very much for giving me this platform to provide my view on this issue of career and supply chain. I've got a link for Africa Resource Center, which is, I believe, somewhere in the slides here, which I hope you can go to and get more information about what it is that we do. Suffice to say, we are an advisory body and funded by the Bill and Melinda Gates Foundation. So if we go to the next slide, what I'm going to do is basically provide I suppose a simple view of what the situation is regarding supply chain and its position within the public health sector, related to structures and so forth. So these 6 points that I've put here, effectively are some of the guiding thoughts that I put together to see how we can paint this picture about what it is that we are dealing with when we look at supply chain within public health. Next slide. So effectively, what I can say is that supply chain, like many of these supporting programs within public health, it's been recognized as one of the pillars of a good, public health infrastructure. We are looking at the 6 pillars that WHO has recommended to member states, and you will see that almost all these subject areas, whether it is service delivery, health workforce development, information systems, and so forth. All of these areas do apply to supply chain. It's not necessarily that there should be, a specific entry which begins to describe that, even though WHO and the UN system overall, they do recognize and they've articulated what supply chain is. Next slide. So if we look back, we'll see that the whole supply chain fits into the discussion around access to medicines, the essential medicines program, which goes back a number of years, in 1977, and maybe some would say even before that. But the fact of the matter is that supply chain as a subject has been within public health sector for many years. And but what we've seen consistently is that it has not really taken grasp within the infrastructure of the institution of ministries of health in our countries. And so what we've tended to see, and I've given a point there, is we tend to see a lot of investments done through health programs, the vertical programs themselves. They will have invested in making sure that they've got excellent supply chain services to make sure that the investments that they are doing in terms of providing of drugs and other health products, those investments achieve what they are meant to do. So you find, as I said, programmatic-based type of supply chain developments. But as I said, this is not suggesting that there is an established structure within the services of public health. And to that extent, it is left, as it were, hanging and very much dependent on the vertical programs to either finance that area of development or else, they kind of use what is available from the general supply chain services. Next slide. So we see that countries have done their best. And this example I've given here of our situation in Kenya as it was, and this is a historical picture from 2001. You see that many different health programs would make sure that their system of supply chain services is articulated, it is kind of described, and to ensure that the goods do get to where they're meant to go. And you ended up with this kind of map of services, of systems and approaches, also which reflects the investments put into this situation. Overall, this picture can be found almost in every country that we may be interested to focus on, and of course, countries, of course, are beginning to move on from this kind of very complex setting to somewhere where they can have some control, central control, regional control, and so forth, to make sure that there's an integrated approach to service provision. But technically and essentially, this is what it has been for a very long time. And as I said before, it is everyone trying to make sure that they've got some structure, visibility, and the assurance that, sorry, somebody's off mute, and the assurance that their products will get to where they're meant to go. Next slide. And I'll just give some picture examples of what government investments are like, particularly in response to the many challenges that governments have been facing. And it's not a secret. If you look at 2020, how the governments have really been shocked by the fact that their supply chain systems have not been working well, and consequently, the pandemic, the COVID pandemic, actually created such a revelation in terms of the status of the supply chain infrastructure. Having said that, if you look at the past few years, you will see that governments have put money into supply chain in terms of infrastructure, right? I'm giving here an example of our situation here in Zambia, and what you are seeing here is what is now something that we invested in a few years ago to got the necessary resources, the necessary support to develop what is now a fairly respectable central medical stores and regional medical stores within Zambia. And you can see here, I'm showing you a system of an automated, forklift system. I don't know what the technical term that for that machine is, but this is something automated that can help you stack pallets at several heights and bring them up or take them down and so forth. Next slide. And again, here another picture of a fairly smart layout of a central medical stores, and this is replicated in the regional warehouses across Zambia. Next slide. And of course, some of these investments have also applied to making sure that goods do get to where they're meant to go. And we talk about last mile services. Here I'm giving an example of what we are seeing across Africa, with the governments investing in ensuring that last mile services are applied, and there's benefits in terms of services to the districts and the subsequent health facilities. So overall, these pictures, what they're suggesting to you is that governments, of course, have recognized that there are issues. There's been a problem, and these problems can be described in many ways, whether it is from human resources or material resources, financing, et cetera. But in any case, they have been responding to what has been seen as an issue. And that response has been in the form of investing, for example, in the development of the infrastructure for the central medical stores or the regional stores and the various other stores. And like I said at the beginning, you will find that health programs have also been conscious of this situation of poor resources, to the extent that you find that in some areas, you find that a health program would invest in creating its own infrastructure, such as storage of its specific medicines at a hospital in the districts. Now, having said that, we can go to the next slide. And what you see here is that, in spite of all this investment, the chronic underperformance of supply chain shows itself up. I mean, we hear consistent reports about shortages, expiries, over procurement, oversupply, things like that. And at the end of the day, the question comes up: why is this not working in spite of the over 50 years of the Essential Drugs Program, or focus on access to medicines, and over 50 years of heavy investments in supply chain services by governments and the partners. And some of the things begin to reveal themselves. For example, you'll find that within public health, it's very rare, and I'm still yet to see a ministry which has got an establishment that shows that supply chain for public health is actually structured within its services. As much as we have, for example, on one hand, we may have the clinical services, we have physiotherapy, we've got pharmacy, but we don't have this thing called supply chain professional services structured within public health, because there's just the assumption that the people who look after medicines should also look after supply chain, and they should know what they're supposed to do to get medicines from A to B, all the way from whether it's the manufacturing sites to the service delivery point. So that assumption seems to be the thing that we've been dealing with forever. And here we have given examples of the fact that even if you look at some of our regional economic communities like COMESA, if you look at their treaties, they are talking about access to medicines. They're talking about the importance of supply chain, but there is nothing specifically saying there has to be a supply chain for public health too. But we've got very good articulation around trade-related type of supply chain. We can get agricultural goods from A to B. And now with the Africa Free Continental Trade Agreement, we are seeing that supply chain is actually going to be very critical to get countries to trade. So this is the situation we have. If I can move on to the next slide. And I'll be very quick because I'm running a bit out of time. So chronic underperformance continues like that. And here one of the things that we will say is that even from the academic establishment, there has been very rare, recognition that supply chain in public health is an issue until recently. So again, that's a reality we have. Next slide. So I think benefits of supply chain will obviously, we will know if we can invest in creating this cadre of professionals, because supply chain is a professional service, just like at one time procurement services was not seen as a professional service. Anybody can go and buy goods. Supply chain has also been seen like that, anyone can get goods from A to B. But I think through a professionalization of this service area, I think these are the list of benefits that we can see. Next slide. And of course, there is going to be pushback. And I would just refer to one pushback here, which could be that if we approach this subject with the ministries of health, many of them might say, there's no need to do this. We know what to do. We just need additional resources. We can create the solutions that we need. Next slide. So I would be suggesting that there is recognition that supply chain is important, but I think we do need to now broach the subject, not just at the academic level, but it also needs to be brought up to decision makers within public health institutions, so that we can see the need for creating a hierarchy and a structure for supply chain professionals, first of all, to be trained, to be the establishment to be created, financing to be made to support that structure within public health. And all these processes obviously require policy changes. They require having strategy in place, but it also requires commitment from government to say, yes, we recognize there's a problem, we recognize there's a need, and we are committed to make this happen. And I think even our donors need also to recognize that we can't continue providing funding to kind of deal with one or two issues that arise. We need to do an overhauling of the way we think and support supply chain. So I'm conscious of that. I've gone over time, and I'll just hand over to Gladys. Thank you very much for listening.
Thank you very much, Dr. Bonnie. Yeah, you really brought out some very good questions, particularly in terms of the development of the profession. That should it be just for the pharmacists, or should it be integrated in the curriculums for the medical personnel? I think that is a question to ponder, and maybe we'll discuss it further as we continue with the other presentations. Professor Andy?
Yes, all ready to go.
Andy, you are there? Thank you.
Yes.
Maybe I'll just say briefly about Professor Andy. He's a professor of public health, and he's also the director of training at the Empower School of Health. And he has co-authored several books, and the Yellow Book, Managing Dried Supplies by MSH, and some of us, we have really used this book. So it's quite good to see that you are one of the authors. And he has also co-authored a book in E-Handbook of Health Systems in Action, with them more than 30 years of experiences working with international funding institutions and bilateral donors in low-income countries. And in terms of his interests, mainly he's on effective management of pharmaceuticals, vaccines, and medical commodities. Yeah, and particularly in the implementation of programs for the introduction of new medicines and rapid diagnosis for neglected tropical diseases. So he has undertaken donor-funded activities in over 40 countries, so it's quite a wide experience. And these were mainly in family planning, commodities, and responses to the early onset of HIV in the 1990s. So it's quite an experience. And he has also been through the Global Fund since the 2000. Professor Andy, you are welcome to continue.
Greetings, welcome to all. I'm going to speak quite quickly, but we will provide you the slides afterwards, and the URL internet links are on the slides. So I think the first question for many is, why would you consider a career in healthcare procurement and supply chain? For many years, it's been a Cinderella industry. It's been sorely neglected. Why would you want to go into that kind of industry? And I think there are two basic answers to that. In the public sector, it's altruistic. Nearly 2 billion people, nearly a third of the world, do not receive essential medicines. That's a huge failure. Supply chain is failing to deliver, even when we have the medicines, even when donors have provided the medicines, we're failing to get them to the people that need them. And part of that is we just don't have enough skilled, trained supply chain staff. The other section is the private sector. And increasingly, there's a recognition that logistics drives the whole national economy. And without serious logistics, there's never going to be full economic development. That also brings much higher salaries and much greater opportunities. The two together are changing the prospects. Supply chain is no longer a Cinderella activity. It's now being recognized increasingly as a real profession that does require skills and training. Next slide, please. One of the major reasons why we have so many problems in supply chain is the lack of human resources. We don't have enough skilled people. And many bodies, from World Bank to Global Fund, seriously state the lack of people and the lack of skilled people in public health supply chain. And there are charts and there are references on the screen to look at to see exactly what those percentages are. Next slide, please. The Global Fund says it's up to 70%. We don't have skilled staff, even if we've got staff in position. They're not trained, they're not skilled. Too often we've taken a medical professional and plugged them in. And that means a double loss. We lose a pharmacist, a nurse, a doctor to medical practice, but we also lose them to supply chain because they've not been trained in supply chain and they can't manage it effectively. We see that underskilled supply chain leads to poorly managed supply chain, poor availability of commodities, and we're failing to achieve health outcomes. We're failing to achieve sustainable development goals. And one of the reasons is supply chain is failing. And it's failing because we don't have enough skilled, trained staff to operate it. And that situation is getting worse because in the pipeline, we have hundreds of new products, new vaccines, new medicines, new diagnostics about to come, which are going to massively increase the volumes required. So we're going to need a lot more people in the future. We don't have enough now, and we need a lot more to come. Next slide, please. Well, why is there no human resource capacity? Because basically you need two sets of skills. And unfortunately, very few skills of pharmacists or nursing or medicine teach supply chain management. And very few management schools teach public health. We need both sets to come together in health supply chain management. That's the key function. That's changing now with the links with the School of Management in Dar. We are hoping that that will now become available. There'll be the interlinking of the two. Just being a pharmacist is not enough to operate supply chain. Just being MBA management is not enough to operate medical supply chain. We need two skill sets, some public health and some management. Next slide, please. Well, who employs procurement and supply chain staff? People tend to think only of the Ministry of Health and only of the World Health Organization. There are lots of different organizations that want procurement and supply chain staff for healthcare supply. Don't think too narrowly, think outside the box, lots of organizations involved. Next slide, please. Well, don't listen to a white-haired old professor telling you that there are jobs. Go and look for yourself. Look on the UN job site. The link is there. See what jobs are going for procurement and supply chain staff. But here's the key. These jobs are for trained and qualified procurement and supply chain staff. Not just for a pharmacist, not just for a management person, but someone who has both sets of skills. Next slide, please. Not just from the UN, also from implementing organizations like Management Sciences for Health, like Chemonics. And the point here that women are welcome in the supply chain. And as I speak now, there is the ongoing conference of Women in Health Supply Chain Management going on. So, because you're female, you are not locked out. You definitely needed. Your participation is wanted and actively encouraged in healthcare supply chain. Next slide, please. There are many agencies around. Well, what about Tanzania? They're all UN jobs. They're all outside. No, these jobs are Tanzania. I pulled them off the website 2 days ago. Again, don't listen to an old man talking. Go and look for yourself. Satisfy yourself that there are real jobs going, and challenging and demanding and reasonably well paid jobs. But in order to attract these jobs, you do need to have qualified and training in supply chain management. Opportunities in supply chain management. The Fédération Internationale Pharmaceutique, the International Pharmacy Federation, says yes. They're encouraging more pharmacists to enter the supply chain. And people who have entered say it was the right career choice. USAID is also funding Operation Into the Supply Chain in helping to train people. So there are activities going on in helping to provide access to real training. Next slide, please. However, the need is for quality procurement and supply chain management training. And regrettably, there's a lot of poor quality around. We look at the report from People That Deliver. Their key focus says they must address health logistics. Doing the Chartered Institute of Procurement and Supply course is excellent for supply chain, but it is not health supply chain specific. It needs to be health specific. Then it must be adult learning. Too often it's school learning. That won't work. The Empower School of Health, we use the ADE, Adult Learning Technology, a well-certified, well-developed methodology of learning, which involves analysis, design, development, implementation, evaluation. It's training for adults, and it works. It must also be competency-based training, related directly to procurement and supply chain activities, not high-level theory on its own. Exactly what's needed day to day, as well as some high-level theory. Empower School of Health has its own competency assessment tool. Right now, you can go and take the tool and use it for free. You can assess your own competency. It's confidential. You only speak to the computer. Only the computer will know your results, no one else. You can try it, it's on the Empower website. Take the assessment, see where you're weak, see where you're strong. Some of you will have already been operating in the supply chain for some years. You can identify particular areas where you might need strengthening rather than the whole functions. But overall, we recommend full strengthening of all PSM activities. Next slide, please. Unfortunately, online learning has developed a bad name because of COVID. Everyone has moved to online. And people think just putting a few slides on the internet is online learning. No, it isn't. That doesn't work. It can never work. Online learning on its own needs to be connected. The Empower School of Health, we use a blended learning approach. We combine online learning, the web-based learning, with face-to-face learning, with micro-learning, with virtual laboratories where you can try out what-if scenarios. What if I do that? What will be the result? Adaptive assessments. You can assess where you're strong, where you're weak, and strengthen the areas where you think you might be weak. Also gamification. And I freely admit, as an old man, I had to learn that playing games actually does help develop some skills. No, you don't play Nintendo, but you do learn about supply chain by operating gamification, by operating these what-if scenarios. The key point around this is it needs to be a blended learning approach, not just a few slides on the web. And Empower School of Health brings that to all its courses, a full blended learning approach with all these activities interlinked and interwoven into the materials. That means it's a demanding course. It requires real commitment to complete. Next slide, please. Certification. Empower School of Health is accredited by ASEC, which is the UK-based accreditation agencies for universities and colleges. Also by many other partners and collaborators, and some are on the screen there, but you get an accredited certification. Next slide, please. Okay, and there are the certificates of accreditation. Okay. PSM is an exciting and challenging area. There are real opportunities. There are real employment prospects. And the COVID pandemic has served to highlight the critical need, the critical shortages of skilled and knowledgeable PSM staff. Right now, WHO has produced excellent tools for COVID. It's got the logistics guidance, it's got the essential supplies forecasting tool for COVID commodities. It hasn't got people who can use them because they don't know how to do quantification. They don't know how to operate supply chain. Staff must be skilled and qualified. COVID has really brought that message home. Times have changed. Procurement supply chain of healthcare is no longer a Cinderella activity. The impact, the requirement is now much more recognized. Thank you. I think that's my last slide.
Thank you very much, Professor Andy. That was very, very informative. Yeah, you have touched the issue of the gender engagement in the professional development. You have touched the issue of quality, yeah, of the skills that are needed for those jobs. But also you have also indicated the need for people to think about the different methodologies of training as far as skills upgrading is concerned. So thank you very much. We have more questions and discussions on the matter at the end. Now we have our last speaker, and this is Adam Rasa. He's Tanzanian. We are proud of him. He's an expert in supply chain. Yeah, he's a supply chain analyst, and with 10 years experience in implementing health supply chain programs in low and middle income countries in Africa. Currently, Adam is working with the USAID Global Health Supply Chain Technical Assistance Program in Tanzania as a supply chain analyst. Yeah, but he has also supported Kenya, Nigeria, and Sierra Leone. He's also a member of the Chartered Institute of Procurement and Supply, that is UK MSIPS. And he has a Bachelor of Commerce from Muhimbili University and a Master of Public Health from the University of the Western Cape, South Africa. So we really have our local expert here who will also share his experience and understanding as far as the gaps. Maybe Adam, you can also indicate clearly the local gaps and where do you think is very important to go on. Adam? Adam?
Thank you so much, Dr. Gladys.
You are welcome.
Thank you so much. I'm really happy to share a few slides with you. First of all, I should appreciate Professor Paul. We met, I think, in 2014 in Ouagadougou, but also Professor Andy, thank you so much. I'm a beneficiary of your book. Dr. Funda, thank you. We worked together here in Tanzania, I think 3 years ago. So, and also Dr. Gladys, we worked together in one project. So I'm working with the USAID Global Health Supply Chain Tanzania. I hope I can be heard.
Yes, yes.
Thank you so much. So our program is purely technical assistance to the government of Tanzania to ensure that supply chain system strengthening is happening, and it has four objectives: strategic planning to support logistics in country, but also we capacity build government stakeholders. The aim is to ensure that capacity is shifted from the partners to the government counterparts. And also we have projects in both in Zanzibar and in mainland. And for the people who are new to Tanzania supply chain, we have now like 9,000 health facilities for Tanzania mainland. And maybe in 2 or 3 years to come, we'll have up to 12,000 public health facilities. So supply chain in Tanzania cover that space. So our main stakeholders in the Ministry of Health and the President Office, PRAG, plus a medical store department MSD. Next slide, please. So 10 years back, when I said for an interview, I was asked, why do I want a career in supply chain? What is my motive? And I gave them my big reason. By then, it was reported like medicines worth 2 billion shillings were expiring at MSD. But at the same time, there was stock out of medicines at the lower health facility. So that created confusion. And I said, I think something is not happening. We had medicine at the central level, but they are not getting to the end users. So I felt that I have a contribution to make. So why do we discuss health supply chain? I think there are 3 main reasons, adding to what everyone has said. First of all, is to improve health outcomes. When our health facilities are well supplied with commodities, people, they trust more the health system. They are likely to seek care there. But also we see even mortality rates for pregnant women and for under 5s, they are going down, and the supply chain has improved. But second, the quality of care is always improved. When you are well trained, you want to deliver. If you are well equipped, you can deliver your best expertise and save the patients. But as I've said, our government has done a lot of investments. Just like my mentor, actually, Dr. Boni Fundafunda said, governments have done major investment in healthcare. In Tanzania alone, we understand the investment made. We are envisioning to have at least one dispensary in every village, one health center in every ward. So it's a lot of investment going there to ensure that the investment is not lost. Commodities must be there. We have a say that no product, no program. So it is very important to ensure that supply chain is working and it can provide medicines and supplies in a right quality, right quantity, right time, right costs to the people in need. Next slide. Next slide, please. Thank you. So I will base my discussion today on public sector supply chain in Tanzania. Traditionally, the main players here are pharmacists, but later on we realized pharmacists alone cannot manage laboratory supply chain. So laboratory technologists also were part of the supply chain. But when you go to lower level healthcare centers like dispensaries, they are just other health-related cadres, mostly nurses. So traditionally in Tanzania, pharmacists were expected to take, and actually they are taking part in managing the supply chain. But when you see the curriculum of the pharmacists, for example, the only area that we touch is the rational use of medicines. Other areas, we are not that much strong. Laboratory technologies, they are more on patient care and testing, but actually now they are taking charge of this supply chain in over 9,000 health facilities. So of recent changes have come in our supply chain space. We see people from IT, please. Yeah, we see people from IT background taking part in our supply chain. We see health financing people, materials management, statistician. So all these now, they are taking part in supply chain. So the traditional players, we know public health, but we have gaps in understanding supply chain management. And the new players also, they come with their knowledge, but they don't have skills linked to public health. So those are the major gaps that we normally see. Next slide. So every time when we discuss about career development, I think many of us will agree with me. There are two ways, formal and informal approach. Formal, it will involve acquisition of knowledge and skill through a structured way of learning. And here we get more of the hard skills, the competencies that will help you to undertake a supply chain role. This one, most of the time, it will involve a formal way, structured way of learning. But most of people also, we learn informal by being exposed and doing, and we learn by doing, experiential learning. So any approach for you to develop your career in supply chain, I think focus should be on both hard skills and soft skills. Hard skills, they are technical competencies that will help you to undertake effectively your role in actual supply chain function, like product selection, qualification, system redesigning, inventory management, etc., etc. All right. But also now there has been an involvement or an emphasis also on you to grow your soft skills. And can you go to the next slide? And when we say about soft skills, those are not technical skills, but are the traits that shape your personality, attitude, and behavior. Things like problem solving, planning skills, time management, people management, collaborative learning, leadership skills. All these, when you grow your hard skills and soft skills, you are a better team player and you can add value to the supply chain. And these actually are 15 skills that are by SIPS 2019. They say in this profession, you need also to pay attention there. Can you go to the next slide, please? So I want us to spend some time here to investigate what are the skills that are needed in the future. The slide I showed you, these are traditional skills that when you have them, you can manage supply chain. But as Professor Andy put it, supply chain is rapidly changing. And there are some many changes that are happening. One of them is innovation and technology. So there are some traditional roles that are now taken out. For example, now truck driving, people are losing jobs. Warehouse operators, Amazon has started to use robots. Data entry, sometime now with artificial intelligence, it might not be there. Inventory management also, those are the roles that now are being transitioned. An example of Tanzania, medical store used to close for 1 month every July to do an inventory. So during that 1 month, people could not get services because they wanted to do an inventory and they will take 1 month. But now, due to adoption of some technologies, they use only 5 days and then they're opening, all right? But as we advance also adapting technologies, it means in a few time, medical store department of Tanzania, we not need to close for it to have the inventory. So we leverage on innovation and technology, and there are some traditional roles that are going to phase out and new roles now are going to emerge. So our really aim now is to ensure how do we manage the automation. Our capacity building should now focus on how do we manage the automation and how do we use the data that comes out of automation. Another change that we see coming is increased data. Now there are a lot of electronic systems in place, there are a lot of data, but they don't translate in actual improvements in supply chain. So data analytics will be much needed skill so that we translate data availability into supply chain improvement. An interesting move that is going now is patient-centric supply chain. Designing your supply chain to meet the patients, all right? Patients now, they have choices. So in 2-3 years to come, maybe even 5 years to come, we see a push towards supply chain that is geared towards a patient. For example, where currently in the public supply chain, when we say the end user or the last mile now is at his facility. But in a few years to come, due to the technology, the last mile delivery might be my own home. I can sit at my sitting room, all right? And maybe there'll be an application which shows which doctors are online by then, and use my telemedicine to consult a doctor. Doctor can do some virtual consultation. He can use the cloud to access my patient data, all right, and generate a prescription to a nearby pharmacy. And that pharmacy will get an alert. That alert will be fed, and they can use drone to deliver at my own house. These things, leveraging on Internet of Things, leveraging on patient data, supply chains of the future are designed to ensure that patients, they have better experience. So we are going there. In Tanzania, we've started to drone technology to deliver commodities around the Lake Victoria Islands, etc. But we are going there very, very soon. But what we have seen now, especially with COVID, governments now are more involved in taking ownership of supply chain. Global donors are going out. This year, DFID, now it is called FCDO, they had budget cuts of 70%. It means now the program that we are depending on funding from UK aid through DFID, now they have to fund their own health systems. And as they fund the supply chain, they start to ask some questions. The Vice President of Tanzania last month, I think, he visited MSD and he asked that they need end-to-end visibility of commodities from the moment it is procured up to the end point, to the end user. So you see this Vice President taking interest in the supply chain. African countries like Rwanda, Tanzania, they showed interest to produce COVID vaccines. So even where the production happens, governments now in Africa, they are awakening, especially due to COVID. Industrialization in Africa has come. So all these are the changes that in future come. So in future, we need many professionals in supply chain. We will need new skills in data science to ensure that the data produced can be understood by decision makers and translate into improvement. We need economic modeling. Why should we invest in drone technology? Why should we use route optimization? How can we save costs? Those economic modeling, health financing specialists will be needed there. But analytics, we need actually. Outsourcing, contracting, very much important, needed. Now MSD is doing some manufacturing, contracting, etc. But also we need a human-centered design, because now it is patient-centric supply chain. These are the skills that you don't learn in the School of Pharmacy. You need to learn, as I said before, you need to gear yourself into self-development. But also we need to include the supply chain performance management. The only aspect I learned in the pharmacy school was the rational use of medicines. Supply chain performance management was not part of it. Now we have interest in artificial intelligence and robotics. Logistimo, in supply, they've done a very good work to model supply chain for vaccines in Tanzania using artificial intelligence. So we need people there, and these people, they need to be built. And this is the future that we are closely going there. So my last slide, what are the practical steps, or maybe, and here I will just speak about my experience. What are the practical steps that you can take to develop your career, both for the now and for the future? Next slide, please. So number one, I say it is both hard skills and soft skills can be learned. When you have hard skills and you lack soft skills, you cannot fit in a team. You are limited. So you need to grow both skills, and all skills can be learned. And the better way to learn, I have just 5 points. One of them, get a mentor. Find someone above your career ladder. I used to see Dr. Boni Fundafunda in eDrug, posting things, writing excellently. I followed him. I saw Professor Paul. He spoke like for 10 minutes and I was impressed. I started to follow what he's doing. All right. So find a mentor so that you can get some guidance. You can get some coaching. All right. But second, enroll in relevant supply chain management qualification, whether it's e-learning, short course, etc. And empower. They have excellent courses as shown. University of Dar es Salaam, they're also coming in this partnership, but also Massachusetts Institute, X series. If you want more data analytics, etc., modeling, they have excellent courses and they are cheap, affordable. So ensure that you enroll. Learning has no end. But networking is also very important. The thing that you are doing now is an eye-opener as to you. Attend these virtual events. In Tanzania, we have a local chapter of International Association of Public Health Logisticians. We have eDrug Forum. You see what is happening in other countries. You benchmark what you know, and by then you can determine your own skill gap. So networking is very important. It is an eye-opener. But also, most people, when they get their degree or master, they stop reading. They never open the book. This is not very good. So you need to read industry-related publications. I normally like Harvard Business Review. It's not supply chain per se, but it has some skills that can help you be a better team player, think about the strategy, and you understand better the global. There's a supply chain magazine and many other resources. And the number 5, I will just recommend you get an industry relevant certification. It will help you. When I was working at malaria program as a pharmacist, I did not know many things about procurement. I worked I was supporting Global Fund program. I could not speak their language before I did my SIPS qualification. So there are a lot of qualifications there, and I will recommend that you take, because it will grow your vocabulary. It will give you more options to grow your career. So my advice is never stop learning. Someone says when you stop learning, you start dying. And they say many people, they die at 20 years and they're buried at 80 years. The moment you stop learning, you will start dying. So make sure never stop learning. If you're a pharmacist, make sure you cover the gap. And if you're not a pharmacist, but we really need you now and in the future, make sure you get a public health perspective of the supply chain, so that as a team, we can make difference in our country, but also support our brothers around Africa and Asia. Thank you so much. Thank you, Gladys.
Wow. Wow, thank you so much, Adam. And the last slide was very, very good, very, very useful for all of us, including myself. So maybe because of time, let us go straight to Rahul. Are you there? I welcome you to talk briefly about the scholarship.
Yeah, thank you so much, Adam. It was really insightful, and also to Professor Mabamba and Dr. Bonnie, Professor Andy, the webinar and the way we need to develop our career, all the things which you told us all was very nice. And now I'll discuss on the major part, which is that UDBS and Empower School of Health, have come into a partnership. And for this, we have opened up a scholarship scheme wherein we'll be, next slide, please. So we are going to announce, I'm going to announce today that there is an open one full scholarship. It means that the fees is free of cost. It's like it's fee waived off, total fee waived off. And then there are 5 partial scholarships, which will be available to people who will apply to UDBS. And there is a process, and I will inform you about the process also. Next slide, please. So as I said, that there will be one full scholarship. The fee will be waived off. It will be exempted for the candidate who will be selected for a full scholarship. There will be 5 partial scholarship. The scholarship will be awarded for, less than $1,000. So generally the fees of our executive of our postgraduate diploma in supply chain management is 2,500 USD. But now for the partial scholarship, the student has to pay only USD 1,500. For others who will miss out this opportunity, it is good. You can write to us. You can write to the UDBS team. We will look into your request, and then you can also register directly through our website for the course. Next slide, please. So basically, how an applicant can apply for a scholarship program is that we will need by an email, you have to send us a brief CV of yourself, or one-page note as to how this course will help in developing your career and an improvement in supply chain management in the country, Tanzania. And for that, you need to write to us on the email addresses provided. You can note down the addresses. However, the slide deck will be sent to all the participants via email, so you can see that later on as well. So it is operations at Empower School of Health and info@empowerswiss.org. And these applications will then be reviewed. The selected applicants will be informed, and then you will all the details of the course is actually available on our website link, which is here, and that you can copy, and even I'll put it on the chat very soon. You can see and register yourself. Next slide, please. So application process is very clear. You have to click on the link, select the course, that is the postgraduate diploma in supply chain management. Or if you feel like there are other courses which are certificate courses, diploma courses, you want to know more about them, you can fill up that application form as well and click on the submit, and the Empower team will then get back to you with the details on the fees and the enrollment procedure. Next slide. So there are payment options available, which is offline, online. All the details will be provided by Empower School of Health once you put an application. Excuse me. You can even do online transfer. There will be a bank account detail which will be provided, and you can also note down my email ID as well as Ms. Sonia email ID, which is mentioned, and you can send us your queries. If you have any queries, you can write to us. We'll get back to you and we'll try to resolve all your queries. Next slide, please. So this is the details on the scholarship program, which we launched today officially along with UDBS for the students who are in Tanzania or the UDBS students. So you can just write down to us, send us the details, and we'll get back to you. And I'll request the UDBS team also to inform as many students, alumni they can through their network. We'll send this slide deck that can be sent further. Now the floor is open for the Q&A session. Over to you, Gladness. I hope I covered it very well.
Thank
if
you.
there's anything you can write down on the chat, I'll answer that.
Thank you. Thank you very much, Rahul. Thank you. So this is a Q&A question. If you have any question, you can raise up your hand. And then when you raise up your hand, please unmute yourself, but also try to use the chat room. I also want to let you know that you get a certificate of attendance at the end. So please stay tuned on that. Apart from today's scholarship, maybe it's also very important that we indicate what is expected from this partnership, that we are going to develop also executive courses, that these are short courses for skills development, but we are also going to have certificate programs, and this is in partnership with Empower. Similarly, we are going also to have the postgraduate diploma, and in the future, we expect to have the master program after the approval of the university machinery. So you should stay tuned with us, that more good things are coming as far as bridging the gap in health supply chain. And please, you see my contact in the chat room. Yeah, don't hesitate to take my email and write to me what you think is the recommendations. I can see we have one question here to you, Rahul. Someone is asking if there is any age limit for the application of the scholarship.
Well, there is an age limit for this applying to the course, and that is that you have to be at least 18 years of age. You should have, you have a very qualified, done your schooling or bachelor's degree. So that details are available on the website as well, and we can send that on the mail as to the people who want to apply. So for certificate courses, a basic schooling is required, and for then they can go ahead with diploma courses, and once they are done with the bachelor's course, they can go to the master's course as well.
Okay, thank you very much, Rahul. I can see there is a comment that someone, Lillian, is recommending that there should be a continuation. Yeah, that is, no, she's saying we should have a module on pharmaceutical industrial production in the supply chain courses. Thank you very much, Lillian. We look at it as we are developing the modules. There's a question, does the scholarship only apply to those in Tanzania?
Yes, the scholarship along with UDBS is applied for Tanzania people. However, we are getting requests from other countries as well, but since it's for Tanzania and with UDBS, so definitely right now we are just saying we are doing it for Tanzania.
Okay, thank you very much. Yeah, so I would also advise that
Can I just come in on that point?
Please, Prof.
Yeah, just to mention that we have launched similar scholarships in other countries as well. And so if you're not in Tanzania, please write to us on the email IDs to either Sonia or Dr. Rahul, and we can guide you for other partnerships in other countries. So that should not limit you from applying.
Okay, thank you, Professor Paul. Adam, we have a question for you. Adam?
Yes, yes.
Yeah, there's a question for you that someone wants to know. When you said you couldn't speak the language, I think when you were in the malaria program, something like that. And then the question is, which is the barrier? What qualifications did you resort to?
Yeah, so by then, actually, I enrolled in a Chartered Institute of Procurement and Supplies, CIPS, and I did a certification in supply chain management from CIPS. And by then, Empower was not yet there. So there were a few options like CIPS. And after which, actually, I was very conversant, and life was very easy for me. Thank you.
Okay, thank you very much, Adam. I want to look for, yes, anybody? Yes, Ambwene, there's a hand from Ambwene. Ambwene.
Thank you. Thank you very much, Gladness.
Yes.
I have a few questions in relation to this. Maybe I can make some comments, brief comments before that.
Yes.
First thing, our supply chain roles in health sector in Tanzania are mostly played by pharmacists or nurses, and in very, very rare cases you find other professions. Unfortunately, for the pharmacists, you see that the distribution of the cadre is sort of inverted pyramid. So you have more qualified individuals at the top, and then you have very few at the lower, which is quite contrary to other professions such as nurses and doctors. So the real pain points in the supply chain in our country is mostly at the frontline healthcare workers, in the districts, in the dispensaries, the health centers. So my question would be, these kind of programs, are they going maybe to expand to accommodate supply chain personnel at that level of lower cadre, maybe in collaboration with universities or institutions that are providing courses for those specific lower cadres in pharmacy or something, maybe to give them a little bit of supply chain components in their syllabus. So that is my comment. And there's the other thing which has not been mentioned, but it's something which I think needs a little bit of a consideration. What would be the optimal staffing level for supply chain personnel in our healthcare system in the country? So I think those are the two pain points that we are having, which may not or may affect the supply chain despite the fact that we are focusing on the probably high-level skills at the top. Thank you.
Okay, thank you very much, Ambwene. I can try to respond on the first one. That is, how is this program going to meet the needs of the different personnel who may be at the facility levels? So ideally, what we have in the thinking is that we are going to have some customized costs for those who are non-pharmacists, yeah, but also for pharmacists for upgrading. And we think we are going to meet their needs because of the methodology that is going to be employed. That is, we are going to do both face-to-face capacity building programs, but at the same time, we are going to have e-learning courses. So we expect even someone is far away, maybe at the facility level in the rural areas, as long as they have an internet, and these days we know, yeah, the internet is there. As long as there is an internet, they can be able to join these courses. And in terms of scaling up, after we have, because today was the launching, then at the business school, we expect to have a discussion with the PORAG, that is TAMISEMI, and also the Minister of Health, to see how we can come up together and come up with a program together with Empower that we can meet the needs of the practitioners. So that one will be addressed in terms of the modules that we are developing, we're going to develop, but at the same time, in terms of the methodology that we are going to do the provision. Your second question, I think that is a policy question on the optimal staffing level. Yeah, I think we have to engage someone from the ministry. That's I think these are the people who can have a recommendation. Or Adam, who has been supporting the ministry. Adam, get ready to, if you have an input on this, on the staffing level, the optimal staffing level as far as the supply chain is concerned. Maybe we hear also from Muzna. Muzna has raised a question. Muzna Mfinanga, you have raised up your hand. Muzna? Muzna, yes. Can you unmute and ask your question? Any other question? Adam? Adam?
Yes, that is.
Yeah, can you say something on the optimal staffing level if you have any ideas? Yeah.
Yeah, so I think it's a policy matter, as you have said, and it should be informed by a study. And the last study was done in 2009 by Dr. Minzi with the support of WHO. So now 10 years later, the things must have changed. But in a nutshell, now we have 9,000 health facilities. They all need pharmaceutical supply chain staff, laboratory as well. But also in the private sector, we have more than 11,000 outlets. These are pharmacies, ADOs, etc. So you can see we have like 20,000 plus, both in public and private, not less than 20,000 places that we need these experts. And the staffing level at each level is different. So it's a study, but it's hard for me to give a number here. It shall be, it need to be informed by the study. And the 2009 study for me is outdated. So I think I'm gonna, in a nutshell, that's it. But I think it's a valid question that we need to discuss with the ministry or WHO to conduct the similar study so that we really know what are the gaps now. Thank you.
Okay, thank you very much, Adam. We are now running short of our time. Yeah, it was a very informative webinar, even for us from the academia. We really got a lot of issues that we think we need to address. I think that is similarly to our partners from Empower. And now we are going to have the closing of this webinar.
Thank you, Dr. Gladness. Let me just say a couple of points and then just ask if Dr. Bonnie, Dr. Andy, and Dr. Mamba just have a couple of closing remarks as well. Every time first of all, about Adam. Adam, thank you. I guess one must be really careful how we interact with people along our lives. The time in Ouagadougou, I was at the Global Fund, and it was one of the workshops that we had done. So brought back good memories, and there were people from all over Africa that were present. Thank you for remembering. And with that, could I also ask, every time I listen to Andy and his passionate delivery, he's always inspiring. So Andy, always thank you very much. Bonnie, amazing stuff that you're doing, especially with the Africa Resource Center. And Dr. Mamba, I really look forward to both physical interaction and getting to know you more. So let me leave the floor open for just very short comments. Adam has already spoken well. Andy, 60 seconds. Over to you for closure.
Okay, we have a number of questions written in the chat box, and we'll try and respond to those when we send the slides out. Okay, we haven't been able to get to all the questions today. That will take care of it. My fundamental message is there are opportunities there, but for skilled and trained staff. No, you don't have to be a pharmacist or a nurse, but you do have to be willing to acquire some public health knowledge and skills if you don't already have them. Go forward and make supply chain happen. I've tried for nearly 40 years, so now it's your turn to go and make it work.
Thank you, Andy. Professor Andy. Yeah. Bonnie? Dr. Bonnie?
Yes, thank you. Thank you very much, Dr. Gladness. Yes, indeed. I think for me, it's just to thank you for this partnership that you are creating, because it is, answering a need, even if it may not have been fully expressed by our governments, but it's a need, and it's a very good start. It is going to provide the material resources for this journey that we are on to reach in the perfect supply chain kind of service setting. So I think it's a very important partnership that is you've entered into now. So I would say we are available to support this initiative and to speak about it to as many of our governments as possible, because you are certainly setting an example, and I'm hoping that in other countries they would take this as a indication that this is possible to do. Yes. So thank you very much.
Thank you very much, Dr. Boni. Rahul, do you want to say something before we ask Professor Mbamba to close?
Yeah, thank you, Gladness. Thank you, Professor Mbamba, and all the speakers. And on behalf of Empower School of Health, we are grateful to you for taking out of your valuable time for this webinar. I have also written on the chat box for the participants to download their certificate of participation. This is what I wanted to tell everyone. Just click on the link, give us your details, and the certificate is on the way in your email box. You'll get it in half an hour. So that way you will also have a participation of this webinar certificate. Thank you, everyone. Thanks, everyone, for joining for the webinar.
Thank you, Rahul. And also, I would like to welcome Professor Mbamba, the Dean of the Business School, to give the closing remarks.
Yeah, thank you. First and foremost, I will appreciate for everybody's attendance, preparation for this meeting. And I hope we'll have a very, very fruitful, we'll proceed very fruitfully so that finally, I mean, Tanzania and the world as a whole should be able to benefit. I know the importance of hospitals being able to offer services, health properly. And I'm sure we are standing at a bigger chance to have an impact, especially this time when we have this problem of pandemic, but even in the future where we are, it's unknown. What we've covered, let it digest and implement, because there's no need of participating, learning a lot of things, hearing a lot of things, and they just end up there. With this, I say welcome to everybody, to the moderator.
Thank you very much, Professor Mbamba. Thank you very much. It's quite a great opportunity that now we have an intervention which will merge the management aspects and the health and through the supply chain perspective. So it's quite exciting for the business school going through this new direction. And we expect with the partnership with Empower and other partners who have shown interest, ARC, and we know more are going to come. Yeah, we are going to have very, very, very useful interventions. Thank you, everyone. And I now request you to do the last poll. Please try to fill the questions. Yeah, thank you all the panelists for your time, for the engagement. It was quite useful for everyone. So as we are closing, please, all the participants, we are requesting you to go to the poll, the second poll. This is very important. This is very important so that we can understand the needs. We can understand, we can have more details as we are going to do more planning on this program. So please take time. I've not seen, yes, let's take time to fill this poll. Very simple questions, it's still 0%. Yes, thank you, 3%, 5%. Yes, please try to fill these questions. Yeah. We appreciate every one of you for your participation. You have our contacts, please keep on giving us more inputs so that we can have a very good program together. Thank you. 38%, 42%, this is very good. 45%, 49%. Yes, please, 50%. 57%, 58, 60. Maybe we can end the poll there. This takes 6%, yes. So we ended the poll, and at least from the poll it indicated that 92% of those who participated are actually interested in a career in global health supply chain. And majority of them, they heard about it through Empower School of Health channels, and then followed by the UDBS. Okay, how most of them hear about this important webinar? Yeah, majority they heard through the webinar, but we also see the impact of the social media. In terms of, there's a question whether one is a member, alumni, or staff of either UDBS or Empower, and majority they were from the UDBS. Thank you very much. And then there is a question whether one has chosen any course with Empower School of Health. Majority they're not yet, but they're actually interested. How did they find this webinar, whether it was useful or not? And then 95% indicated that it was very useful. And this is quite a very good feedback. So thank you everyone for participating in the poll, for participating in this webinar. Yeah, thank you for the questions and the excitement. It has really gave us the energy to continue that this is something that is really needed and is going to bridge the capacity gap in our health supply chain. So keep in contact with us. You have all the contact for Gladness from the University of Dar es Salaam Business School, and you also have one for Sonia from Empower. And we expect to continue with the engagement. So with those remarks, we declare that the webinar has been closed, and make sure that you have downloaded the link for the certificate so that you get your certificate through your emails. Yeah. Make sure you have the link. Yeah, for the webinar certificate, it has been posted again. Make sure you are going through it so that you can get your certificate. Thank you very much. Our partners from Empower, Rahul, and the whole dream team. Yeah, this is a dream team. Professor Paul, Professor Andy, Sonia, and I know there are a lot of people at the background. Thank you so much. Thank you for Professor Mbamba. Yeah, and thank you all the panelists, Adam, Dr. Bonnie, and Professor Andy. Yeah, let's continue with this engagement.
Thank you, everyone. Thank you so much for your time.
Thank you.
Bye.
Yeah,
Bye.
so we are closing the webinar now. Thank you very much. Thank you.